everyone, welcome to the channel Knowledge Star, Continuous Knowledge Excellence. My name is Nisha Masroor. In this video, we will get to know about how can we define nurses in today's scenario. Now, Dr. Ashia Qureshi, Dean cum Principal, School of Nursing, Galgottias University, Greater Noida, will explain you in detail about this topic. So, to get complete information, watch full video without skip.
Discussion on nursing technology, innovations and its implementation. We all know that a lot of work has been done and a growing number of new technologies are becoming available within nursing care that can improve the quality of care, reduce the cost, or enhance the working condition of nurses and the patient satisfaction. However, such effects can only be achieved if the technologies are used as intended and invented. Now, in the Western world, we have the panelists with us who are using these new technologies. You know, the patients are benefited and the nurses are also benefited. But if we see the scenario in India, we see that a lot of work has been done on the new technologies, but when it comes on the part of implementation, the resistance to change is there, which we have to reduce this gap. Many new technologies are becoming available with nursing care, such as, you must be knowing many of them. You may be using some of the electronic thermometers and electronics, VP sphygmomanometer and vein detectors, all these small things, we know that and we are using that in some of the hospitals. So I can name few like home dialysis equipment or new infusion pumps that change the nursing staff daily routines. In addition, all kinds of technologies that support distant care, such as telecare technology, have consequences for nursing practice. Another development is the introduction of electronic information system, such as electronic patient record, which Mrs. Chakravarti is going to throw a very detailed highlight on that. Technologies are aimed at increasing the quality of care, reducing healthcare cost, or solving workforce problems. It is widely recognized that one of the main problems with the introduction of innovations in general, such as technologies or clinical guidelines, is that professionals do not automatically use them as intended by the developers. This means that a substantial proportion of patients' clients will not receive the intended care in such a way that they benefit from those innovations. Our focus today during the panel discussion by the experts will be on the determinants of a successful introduction of new technologies used in nursing care. Several models and frameworks exist on how to introduce innovations in healthcare effectively. By innovations, we mean, for example, guidelines, interventions, or programs that are perceived as new by an individual or organization. Most models originate from the diffusions of innovations theory of Rogers. All of you know that, Rogers, theory of innovation. Despite some differences, all models follow a similar planning sequence. That is, the innovation should be introduced systematically to maximize the success, and a planned innovation strategy should be tailored to the determinants that facilitate or impede the intended innovation process.
Wait. Are you worried about your project, training, dissertation, internship? Don't think too much because Nanoscience and Technology Consortium, in short NSTC, is giving you a golden opportunity to do the same tasks. NSTC also conducts workshop on amazing topics. So if you want to register in the workshop, the registration link is given in the description box below, or you may go to the website www.nanoschool.in where you can easily enroll in the workshops. So just check it out right now.
Dissemination means that every professional is actually supplied with the innovation. At the adoption stage, the professional will develop a positive or negative intention in the use of innovation. During the implementation stage, the professional tries to use the innovation in daily practice and experiences what working with the innovation means. Finally, there is continuation stage in which working with the innovation becomes a routine practice for all of us once we'll put it into practice. The need for innovation technologies in healthcare education and service has never been greater in India or in various Asian countries. We have certain technologies which a lot of work has been done on simulation-based learning, virtual nursing avatars, all of you must have heard this, health information technology for patient safety, professional nursing care documentation in acute care setting, electronic health record, driving evidence-based, catheter-associated urinary tract infection practices and all, challenges in high fidelity simulation, risk sensitization, improving communication, promoting safe use of medical devices, integrating YouTube into the nursing curriculum, unlocking the power of innovation, the critical nature of early nursing involvement for introducing new technology, simulation techniques, etc., and so on. Here is a widespread agreement among members of the healthcare community, all of you are sitting here, and the public it serves, that the transformation of healthcare is a top social priority. Supported by a series of pivotal reports addressing medical errors, patient care quality, and education for health professionals, the 2003 Institute of Medicine, that is IOM, document cited 5 core competencies which is required by every nurse, physician, and other healthcare professionals practicing 21st century healthcare delivery to the clients. Now these competencies includes, what are those competencies which all of us should be acquired to practice the innovation? Patient-centered care delivery. Number 1 is a patient-centered care delivery, that is the ability to work in a multidisciplinary team, evidence practice, a strong focus on quality improvement, and the use of information technologies. Given the currently limited level of competencies in these areas and the apparent failure of the education system to prepare healthcare professionals for this reality, the need to focus on new technologies in healthcare education and service has never been greater with us. The application of modern technology is an essential factor required for the advancement of nursing. Healthcare itself and continuous monitoring of patients requires using of information communication system. However, information communication system is essential for efficient implementation of nursing documentation and effective providing of healthcare. Information technology in healthcare involves the processing and application of information and easier access to patients' history of care. Data entry, data conversation or data conversion into useful information and the application of data affecting the healthcare system are the factors including in this process. Nurses who provide direct healthcare are among other specialists registered nurses with advanced practice, coordinators of care, visiting nurses and health promoters and so on. In short, they are everywhere where nurses work. In the past, prior to the development of medical technology, nurses relied on their own senses of sight, touch, smell and hearing to follow up on the status of the patient and detect specific changes. Although we should not forget all those things. When the new technologies we are inventing and we are using the new technology, we should not forget our traditional, the impact of touch, the impact of communication, the impact of observation for the patient. Now, I will just tell you, I will just make it short. There are certain studies which are done by many people, and I will just quote one. The Botsman et al. Reveals that the use of the intensive care information system in patients after cardiothoracic surgery affects nursing activities. Using ICIS reduces the time nurses spent on documentation up to 30%. In private life, we have adopted to new technologies. When we accept new technology in healthcare, we can reduce physical exertion of the nurses and increase the productivity. The new technology can improve communication between nurses and the patients, other healthcare professionals and the patients and the family. Patient safety can also be improved if the entire medical history of patient was available to every department in the hospital. By identifying how technology can improve our work and service that we provide, we could achieve more time in direct contact with the patient, and nurses play an active role in the innovation and use of new technologies. I am giving little more detailed information to you because over one panelist left, So I am giving you a little bit of that, little more of before starting the panel discussion, just importance of this. Now, implementation of technology in nursing practice in order to maintain control of the complex system that is implemented in healthcare. Systems that are based on knowledge are set to become a major component in the skill of nurses. Modern technology represents a new challenge for healthcare professionals, especially nurses in the care of the patient. Nurses must be familiar with the technology, which requires additional training to provide quality healthcare. Whatever innovations, whatever new technology we have invented, it comes when the implementation part of it comes. Lot of training, lot of skill development is required in the nurses.
I hope you liked the video. Okay. You will also get to watch its second part in our upcoming video. So, to get connected, subscribe to the channel Knowledge Star and hit the bell icon to never miss an update. And if you want to see more videos like this, do comment. We will definitely reach out to you. Thank you.
For more updates, subscribe to our channel, click the links shown on the screen to stay connected.